Our next presentation is going to be from the Northern Cape province, and we've got 4 presenters that are going to take us through the presentation. The first one is Dr. Stephen Jonkers, who is the Deputy Director General for Policy and Governance. Then you have Ms. Sunita Valab, who is a Senior Manager, Monitoring and Evaluation. And you have Ms. Jakoba Meyer, who's a Senior Manager, also Policy and Planning, Strategic and Spatial Planning. And lastly, you have Ms. Pamela Nogwili, who's also a Senior Manager, Monitoring and Evaluation within the province. Over to you, colleagues.
Good morning, Program Director, and good morning and greetings to all the colleagues on the platform of this session. I think we're going to proceed with our presentation from the Northern Cape. I would also like to extend our appreciation to the colleagues that have just presented from Gauteng and Western Cape. Thanks very much for the learnings and lessons and insight that you have given to us. I think I will ask my colleague, Pamela, just to continue with the presentation so that we can zoom into business of the day. I'm just waiting for the presentation from Pamela to set it up there, put it up.
Can you see it, DDG?
I can't see the presentation. I don't know whether other colleagues can see it.
We can't see.
Can you see it now?
Yes.
There it comes up now. Yes, thanks. You can just then go to the start of the presentation. Thanks very much. We can proceed.
They can put it on a presentation.
It's there. It's visible now. Pamela, we can proceed. You can go to the next slide.
Can you see the next slide?
No.
It says it is sharing the screen. I'm now not sure what's happening. I'm sharing it again.
Yes,
it's
and
visible.
Please, it's visible, but please put it in presentation mode. Click on a start
I have done that. It is in presentation mode from my side.
On our
Yeah, but it's just not moving. If you can just maybe start to
I'm
move
going to
it.
end this one and then redo it.
Pamela, it's fine now. It's there. I can proceed. Okay, thanks very much. On the background and the context, the Secretary noted of the United Nations that we have been brought to our knees by a microscope virus. It has laid bare risk we have ignored for decades: inadequate health systems, the gaps in our social protection, structural inequalities, and environmental degradation. The climate crisis have also bring us where we are. As we see that pandemics comes across nations, there was the Black Death that has killed 20 million people within a period of 5 years, and it was still estimated to continue also in Eurasia from 75 to 20 million. The Spanish flu, also in 1918, affected 500 million people and killed between 100 million people in those periods. And what have now come down on our land or in the world at large is the declaration of COVID-19, of which I have declared this as a pandemic since the 11th of March 2020. Okay, Pamela. The next slide. We are then looking at the current status. Pamela, you can please put on the slide.
Something is not happening on my side.
All right. It looks like we are experiencing a technical challenge there when it comes to the presentation somehow. So we'll give them a little bit of time to sort that technical problem. So, Mr. Godfrey, what are some of the key themes that you're already picking up from at least the two past presentations?
Okay, can you see me now? Yes, I did.
So I think that's where my problem is, because it's not picking my name.
All right. Oh, it looks like the presentation is ready there even before Mr. Godfrey can respond to that. All right, we may continue with the Northern Cape, please.
No, thanks very much, Chair. The current status, you will even see that the data that have been released yesterday, daily deaths countrywide is 167. And as you will see that the Northern Cape, the total deaths is at 994. The Northern Cape is actually currently the highest in terms of active cases. Pamela? Now, Chair, with regard to our assessments or case studies, we haven't per se concluded a case study because of constraints in the research and evaluation units. And as you could have seen that the other provinces, especially Gauteng, have been making use of the professors from the different universities and stuff, and unfortunately, we don't have those capacity in the Northern Cape per se, especially more so in the office of the Premier. But nevertheless, we have still continued with the work. We have do this work through our assessments, and then also, Chair, we have set up structures where these things have been dealt with, like the PCC and also the Prov joint, and I will elaborate a little bit around that one. And that is where we have accumulated our information and assess and then monitor also the aspects of COVID-19 within our province in that regard. Also, we have taken the quarterly evaluation reports where the team have also been analyzing, and we have submitted those also then to DPME. We have also then, Chair, conducted a public research on a mini scale with regard to COVID-19 as a good administration or governance principles, where we've just tried to take some of our communities on board during this period of the pandemic. And that we have done it within the guidelines of the Constitution, the SPLUMA that says that we must consult and so on. So COVID-19 have restricted our people, so we haven't done it on a full scale because we know that what was the situation around that matter at that stage. Pamela? Now the approach, as we have said, to monitoring, we have monitored and assessed our situation in the Northern Cape in line with the National State of Disaster and the Disaster Management Act and the regulations. We've also aligned them to the DPME requirements. And also, Chair, we have also have provincial integrated monitoring that was concluded for those financial years. The sources that we have used for this COVID-19 assessments, the primary source was departmental reports, as I've already pointed out, and the secondary was the Prov joint meetings. And the Prov joint meetings have been held on a weekly basis, every Monday chaired by the Director General of the province, and then also then every second week, the Premier then chaired the PCCC. And now the Prov joint chair have actually served as a center from where we have been monitoring, assessing, and then also then tasking activities from whether it's to the districts or to specific departments. But we also have to indicate that is also where the intergovernmental relations framework was then implemented with all stakeholders involved in that platform. Now the public research, as we have already said, we have first then also made countrywide in our own country, we have taken note of what is happening, but also in various countries, we've also been checking what are the situations, and we have then adapted them according to our own situations within our province. Now, our governance finding on governance matter, our findings, Chair, there was definitely regression with regard to quarterly provincial performance, which means then it hampers then on the service delivery aspects in general to our communities. As you could have seen then from first quarter to the third, before the previous years was 77, 78, and 76, and it definitely took a dip from 231, 54, and 62. And as you know, there was a lot of factors contributing to that, like financial budget cuts and readjustment and so forth. But in certain instances, yes, service delivery to our community on the daily aspects have taken a knock. Okay, Pams? On the social findings, Chair, during our assessments and evaluations, and also the discussions and taskings in the Prov joint on the social findings, health and education sector significantly was affected. Immunization rates dropped from 72% in the first quarter to 68% in the third quarter. TB screenings rate reduced to below targets of 66.5%, and the national school certificate pass rate declined by 77% and then again by 66%. The dropout at our schools increased, and we know that is because of the inequalities. Most of the other advanced schools have to go to e-learnings, and the other government schools couldn't afford of e-learning. There was a lot of dropouts, as we have realized in our province. And the Department of Education have provided workbooks and worksheets online, but as we have said, that technology have hampered our people to fully participate in their education situation. There's also closures of schools which have impact for learners with regard to food insecurities, especially in our impoverished communities, because they are dependent on the National School Nutrition Program. Increased incidence of school vandalized. For example, we see 404 cases reported, which is a very high number, and then it has also have impact on our budget for infrastructures and so on. Also, the increase in food insecurity households, because people couldn't have gone to school, we couldn't have provided oil, each and everyone, and the people that was not in the programs, couldn't vent for themselves, so that was also having an impact in that regard. The increase in incidence of gender-based violence, sexual offenses increased from the first quarter with those numbers from 198 to 473 in the third quarter. We've already indicated around the issue of food insecurity and where the people have actually become dependent on food parcels. And then, Chair, more on specific on the education as part of the social findings. We've also spoken about the effect of the schools, the technological issues, the worksheets, but our people couldn't manage, and the failure rate was very high, as you have noticed during the 2020 release of the results of the National Senior Certificate. Chair, provincial interventions on online, what we have done as a province, online school registration was launched in 2020, and that was the first time we have followed Gauteng, where the children could have then registered online. So that have helped us a lot to keep our children in schools. Provision of additional academic and support staff was implemented. We've also implemented the National School Nutrition Program. Teaching and Learning Recovery Program was implemented, and we have also conducted and managed administration the merge of 2020 National Senior Certificate and the Senior Certificate examinations. More appointments of cleaners and screeners at school, so there was at least, to a certain extent, job opportunities created. We have also partnered, Chair, with private sector, especially in the Northern Cape. We have established a Maths and Science Leadership Academy, and that is also helping us to then keep up with the backlog, especially in Maths and Science, and assist our children to proceed with their schooling in that regard. Pamela? Pamela, next slide, please. Okay, and on the economic front, Chair, the findings there, the employment rate, as we know, nationally have taken a knock. They have dropped. As you can see, the percentages there from the first quarter to the April to June 2020. The formal labor market has been protected by legal and social contracts, but the people that have suffered most was the SMMEs under the tremendous pressures because they have to stay at home and they couldn't fend for themselves. Casual workers and those in the informal economy unable to access unemployment benefits, economic relief, and measures because some of them, as we know, they will have to register on electronic and technological stuff, and they doesn't have those facilities. Infrastructure projects have also taken a knock. They came to a standstill, like the Buhuber project, the R warehouse, and the Namakwa SEZ, where we also have intended to create some job opportunities for our people. The same with the EPWP there was also delay in the implementation of conditional grants. Also, the negative impact on provincial tourism have also taken a drop in the numbers. Pamela? If we look at the research of the public participation, where we have tried under the difficult circumstances to get our people on board and to keep them abreast on what is happening during this epidemic side, although it was challenging, but we have tried to do some things. In the Northern Cape, the communities and municipalities are facing specific challenges that requires a unique approach to different situations. The remoteness of the areas, limited resources, whether it's human, technical, and financial, different community profiles, and access to services like the ITC, as I've already contributed. And all those issues, we have to consider them during our approaches. Most popular methods remains the large-scale meetings. Printed social media is also distributed by means of letters and posters that we have also then distributed. The socio-economic environment is a crucial factor to consider in public participation, most likely reasons for the meetings. And then also, Chair, to unlock potential alternative approaches, different government spheres will need to introduce a socio-economic profile system. If a record of profiling is pre-approved by the relevant authorities, an authorized official can advise on which options or alternative approach we can follow. Next. We have already alluded to the issue of the public participation. Pam, the next slide, please. Next slide.
It is there.
Still,
It is there.
Yeah, okay, thanks. Thanks, there's it now. Now, also, we have looked at what worked well for the province, what worked well in terms of the COVID assessments. We are saying that integration and improved governance and coordination, and that, Chair, that's really been happening to the Prov joints, as I'm saying, on a weekly basis, been chaired by the DG, that all stakeholders have been involved, even the district municipalities. With the district development model, we have also started to reduce duplications and pooling of resources in order to respond to our intervention. We also know that in some instances, under the difficult circumstances, indeed, the aspect of Ubuntu have come where the communities have also been assisting and been sympathetic to the challenges that government have been facing in order to deal with this pandemic. The Northern Cape health system, despite operating under strained capacity and resources, was proactive in its tracking and tracing to contain the spread of the virus. So precisely, Chair, as Western Cape have been done by hotspot, when we discuss the issues in the Prov joint and where we identify a hotspot, we immediately send out a team into those directions. Regular communication and updates to the President and ministers have been provided a sense of confidence in government. So we have appreciated that, so that when we receive the information, we immediately distribute to our communities, and they show that there was synergy in our approach and we are speaking from the same page. So, Chair, also the resources mobilized for vulnerable households to bolster government efforts in terms of food security and social relief have also been successful within our province in that regard. The provision of additional academic and support staff teaching and learning recovery programs have been put in place, and we have already pointed out the issue of extra support staff with regard to cleaners and screeners at schools and also in the Department of Health. Then also important that what have worked well, Chair, in our rural areas, in some instances, there were some times that our people have to go far for water, but these have also assisted us to engage the Department of Water Affairs, where we can distribute water tanks for our communities, and they have been very much supportive of those initiatives. But also worked well, the public participation, looking at e-governance online tools, as we have already indicated that last year for the Department of Education, we have implemented that. We have developed a participation culture, capacity and competence. We share views without fear of victimization, comments on record for future references. We will see that also there, the Premier have also sometimes on the social media invite for inputs from the communities, and we have then also worked from there. Meetings, minimum cost and easy to organize. Conferences allow interaction with experts and opinion leaders, and focus group discussion have yielded consensus and feeling of enrichment, and participation orders of government policies and legislation have also assisted us greatly in this regard. what do we need, Chair, to do differently? Also here we say improve the capacity of the state to respond immediately to the real-time plight of the poor as weaknesses in planning and budgeting were exposed. The required reallocation and reprioritization of resources, as we've said, from our budget that couldn't allow us to reach our objectives as set, both human and financial, have forced integration between the three spheres of government, and that have helped, and we could have heard it also then from Gauteng and Western Cape, that actually that one have also really assisted to bring the three spheres of government nicely together in the integrated framework. Improving compliance to regulations with specific reference to municipality and bylaws, environmental health regulation, capacity required at local government level to monitor implementation of bylaws and address neglects. As we know that at government, capacity still needs to be strengthened, so we have to zoom in and out every time at that level, because that is also where it happens most. But we have also indicated, Chair, with the DDM model, which we have already started to implement in the province, have helped us to have now that integration. The potential of the taxi industry to become a major player in the economy is still undervalued and under development, and thus there's unity among various taxi associations is to be addressed. Here and there was sporadic incidents where the taxi industry was sabotaging actually still the people that were vulnerable not to travel to and fro from economic hubs. The center is required as a permanent structure armed with the necessary capacity and rapid response mechanism for such outbreaks and disaster conditions, risk-based. The supply chain management process, red tape, to be reduced for rapid response to the pandemic, and we have heard also then from Western Cape when they have also been mentioning around that aspect. Access to the e-health, e-education, and e-governance in the education sector to incrementally re-engineer the method of teaching in the direction of e-learning, to address the systematic weaknesses in the health sector so that as quick the universal coverage can be implemented. It will assist a lot, but up until now, the pandemic to a certain extent have also assisted at least to move into that direction, while we have brought in more beds and also other technological stuff to assist our patients. Enhancing integrated planning and joint budgeting. We're in that process, Chair. Based on all these learnings that we have done as the Office of the Premier, also busy now with the governance model, we then enhance all these aspects that we are taking, and all the viewpoints of the different sister departments are also been taken care of, and we forward those ones to the Executive Council. Improving state society, social compacting and promoting participatory governance, stellar channel, especially under such difficult coordinations, and we have also learned from Western Cape how they have applied it and what more they must do, because it's very important that we need to take the broader community on board. In the Northern Cape, due to the remoteness of our areas, a unique approach to service delivery required. Programs designed, developed nationally to be reviewed so that we can fit it to our purpose within the Northern Cape context. Okay, Pam. Also, we say then, what do we do then, Chair, to need to do differently in the education sector? Incrementally, we've already spoken about the e-learning due to social determinants of health and food security, water, resulting communities more susceptible to the COVID slow pace of housing delivery to be addressed. And we know what is the effects, especially in our rural areas, of people staying 10 in a house, 8, 7, because our communities are vast and there's not sufficient shelter for them. The provision of shelters, as we have already now indicated, for the homeless has been a temporary solution, and post-lockdown sustainability is dependent on finalizing roles and responsibilities and coordination with the local government sphere, and also finance to that effect. A central coordination social relief program in partnership with local government is necessary, including a compilation of database and destitute household, synergizing of common agreed upon criteria for the province across departments of social development and SASSA, together with the municipality indigenous registers, is required. With most of the economic relief measures as per the stimulus package being granted nationally, local development agencies and entities to be brought on board to ensure that the local enterprises benefit from these initiatives or measures. And we have to indicate also, Chair, what we need to do also is also that, as we have seen that in Western Cape, really with regard to social society involvement in these processes, we have to enhance, even in our as participants, we have to see how we have to address and bring them speedily on board. And we like the initiative where they said that within a horde, they have that response teams and so forth. In our recommendations, Chair, we said to improve social relief, partnership with local government, it is now there, Chair, in the different forms, when the Prov join, but also in the IGRs and so forth. Compilation of a database of destitute household, we also looking at that, and we also deal with Department of Social Development to provide us with some of the information they have in that regard. Synergizing of common agreed upon criteria for the province across DSD, SAS, and municipal and indigenous registers are required. We also said to improve public participation, build on engagement strategies or know-how, broad diversity of active actors, and build strategic alliance, more or less what the Western Cape is doing. Innovative in methods by introducing diversity of participation methods. We must use then printed media, actual meetings, conferences, seminars, online participation, and so forth to get our communities and also involved. The extension of time frame to ensure adequate participation must happen, although it's sometimes difficult depending on which level of the lockdown stages we are. Introducing and phasing in e-government platforms, I think that one is a very important one where we can then have ample opportunities to engage with our communities. Ensure relevant bylaws, policies allow for different forms of participation. And to improve integrated planning and budgeting, build on the gains of the COVID-19, coordinating structures in line with the DDM approach or model for all government intervention programs. The establishment of a provincial disaster management center is required, but I can't say, we can say there is already been established as a permanent structure in the necessary capacity and rapid response mechanism. So a rapid response team have now been set up in the team under the leadership of the Department of Cooperative Governance, then reporting also then to the Prov Joint and the PCC. Okay. Okay, that brings us then to the end of our presentation as the Northern Cape. Thanks very much.
Great. Thank you very much, Dr. Stephen, for the insights. And it's very clear that there are certain factors that remain the pillars behind the success of responding to this pandemic, such as collaboration with the private sector. There are some few questions for you. The first one is, how are you managing the increase in cases? Can you track the hotspots?
Yes, Chair. The increase of cases have been monitored, as I've already indicated, in the point. Actually, most of the time, the biggest department providing input there is the Department of Health, updating us on a weekly basis what is happening. Even the Department of Health themselves, they have field workers, they have response teams that is going out and they are monitoring the cases, and they have the stats where the increases are, where's the hotspot, what are the numbers of the increases, and then also we are then coordinating and also then activating responses to those concerns in those specific areas. For example, the last time what did happen in Namakwa, the schools and so forth, so the whole team of health and the other departments were then zooming into the hotspot areas. So indeed, we have all the stats available of the increase of the numbers and so forth. That's why you will see that in our presentation, we've also been indicating that at this point in time, the Northern Cape province is actually the second with regard to the infection rates.
Great, thank you. And coupled with that, how is the rollout of the vaccine progressing in phase 2?
Yeah, I will give that one over to my colleague Sunita Valap, because she's doing that monitoring from her side, monitoring relation, and you are doing at the phase code to those kind of issues. So I think she has this information.
Okay. Your colleague is online, isn't it?
Okay.
All right.
Thank you. So the vaccine rollout has been executed as per the plans of the National Department of Health, and currently we are on target in terms of the numbers that are to be vaccinated that has been planned for the healthcare workers. With the phase 2 vaccine rollout that began on Monday, on the 17th, facilities have been identified and rollout is as per planned. As the province, we have done the monitoring of the vaccination sites. And I think out of our monitoring processes, the findings that we found has been very minimal in terms of compliance and the regulatory areas at a facility level. The biggest issue that we picked up through the monitoring of the vaccine sites was the slow registration and responses on the registrations, and one would find that there was more of a queuing taking place at the vaccination sites due to the response on the registrations on the systems that's issued by National Department of Health. That was the one finding. And the other finding was the management of or the schedule of the health workers, and that was with the initial rollout of the vaccine. That was not properly planned and properly managed due to the fact that the registration responses, especially with regards to the vouchers, were not reaching the healthcare workers timeously. Other than that, in terms of compliance or with regards to the facilities, the various protocols that needed to be in place, refrigeration of the vaccines, we did not find any challenges with that. So our vaccine rollout is on track. We started promptly on Monday as well with the phase 2, with the Pfizer vaccine rollout, and there has been I think what is very positive in our province is the role that our executive plays with regards to bringing the messaging down to the communities. Not just the social media platforms that we are utilizing, but we're very much aware of the rural nature of the province. So our communication plans is taking into consideration that how do we reach the most rural areas? So local councillors using our ward committees, engaging at a local level through community structures is also assisting us in spreading the message around the vaccine rollout program as well. Thank you.
Great, thank you. We know that food insecurity cuts across many areas. What steps are being taken by the province, and are you involving the private sector in addressing that challenge of food insecurity?
Yeah, maybe Jakoba, you can assist with that one, please. Or Sunita.
Thank you, Chairperson. In terms of food insecurity and security measures, the provinces went actually the extra mile. And I think what Ms. Wallop and Dr. Jonkers referred to is that there's such a close collaboration between the private sector, even the NGOs, the churches, the private sector specifically in our priority sectors, which is the renewable energy space. We had huge support from our renewable energy providers very early in the pandemic, and it's still continue, looking specifically at the hotspots in terms of food insecurity. The unfortunate part with the pandemic, with us as a province facing such huge unemployment rates, this actually just exploded in the sense of we were highly dependent on SMMEs, and SMMEs were the hardest struck with the COVID-19 because of not having any backup savings to support them. And fortunately, we were able to access some of the funding through the national programs that was outrolled. But for us, in terms of food insecurity, it's visible looking at the SASSA grant access. In terms of the accessibility, We try to mobilize and ensure advocacy, how to access these extra support grants for people of the Northern Cape. So for us, the stronghold was the close collaboration with our private sector, even in the agriculture sector, mining sector, and ultimately this laid the foundation for the institutionalization of this methodology through the Command Council. In October last year, the province adopted a governance model based on the methodology of the Prov joint and the Council, PCC in the Northern Cape. And ultimately, this will then just strengthen this foundational social compacting that took place to support and look at the hotspots in terms of food insecurity. Thank you, Chair.
Thank you very much. Another issue that came up earlier in the presentation is access to experts. Gauteng perhaps has got an advantage being the host to a lot of institutes of higher learning and research. Perhaps my question is directed at Mr. Godfrey to say, how do you make those resources available to other provinces that don't necessarily enjoy similar capabilities?
Yes, I think through the office of Dr. David Makado, there is facilitation that has been taking place for the compilation of the counter report. The partnership that we've had with we have with the National Research Foundation has managed to mobilize a whole range of experts from across sectors that have assisted in that process. I'm sure discussion can be entered into around how such type of capacity can actually be mobilized to support a case study work in the level of provinces.
Okay, thank you very much for those insights. Another key issue that came up is the fact that there were gaps that were identified during this process that showed that even prior to COVID, our processes needed to be streamlined and upgraded. Now, how much work has been done in your province to identify those processes, and what are the measures that you're going to take to enhance them? Basically, using this process as an advantage to identify those gaps and address them accordingly.
Chair, I haven't grasped the earlier portion, but I think I will ask one of the colleagues maybe to respond. I've just read the portion.
Mm-hmm. Oh, you want me to repeat the question?
Yeah, please. I didn't.
Let me repeat the question. This COVID environment has highlighted some of the gaps when it comes to our processes, the gaps that existed prior to COVID taking place. So my question is, what are we doing to identify those gaps and address them going forward?
No, thanks very much, Chair. What we have been done, first of all, is really the whole issue of integration. And then also the second issue on all these gaps that have existed. And secondly, also, as we have said, is the reprioritization of the budgets and so forth, and also prioritizing certain focus areas. As you know that, for example, the Premier actually has pronounced as a vision of the province as a modern, growing, successful province. And then even before the pandemic struck, that vision was already in place, and we have actually instructed departments to move into that gaps, especially that's why you hear actually we have also mentioned around the issue of e-registration of the Department of Education. Also the Premier steadfast with regard to the Department of Health, where we also have there, first of all, especially in the gaps, they have actually also then enlisted, Chair, they have even enlisted retired nurses also to support with the gaps that have been there with regard to shortage of personnel and so forth. And I think then Sunita or whoever can just add on the other aspects.
Okay, thank you. one of the biggest problems is, and I think the two prior presentations already highlighted that within the Western Cape and Gauteng province, is as government institutions, we tend to operate in silos. And the breakdown of the silo mentality has to be our first charge. And I think really is the first learning lesson that has come out of this COVID-19 pandemic. In the presentation, you would note that we've said COVID-19 has actually forced us to pool our resources and work together. Moving forward, this should become the norm and should not be the exception. It has been the exception to date. One of the things that as a province we are mooting for very strongly, and perhaps the other provinces would want to pick up on this as well, and in the later discussions, is our budgeting model is not creating an enabling environment for integration. When we talk integration, and if we're really wanting to break down silos, our budgeting model has to change within government firstly. We budget according to sectors, yes, but there is an inward-looking approach to budgeting as opposed to an outward integrated approach to budgeting. We have the MTSF priorities there. If you take food security as an example, and the learning lesson that we found from COVID-19 is to address food insecurity. Various partners came together. We established in the province a multidisciplinary response task team. And this task team was made up of different stakeholders from a national level and provincial level and the private sector, which my colleague, Ms. Meyer, spoke about. But if you just bring that multidisciplinary task team and response team home within the government space, we're sitting with national and provincial departments with various sectors that deal with food insecurity, but we are duplicating the budget across agriculture sector, the social sector, in the education sector, through the school nutrition program, etc. And we are targeting the same communities through different sectors using government resources in an environment where we are finding ourselves constantly challenged with a diminishing fiscus, specifically in the Northern Cape as well. $1 million budget cut on a department impacts very significantly because we only get the smallest percentage of the national fiscus. So really, something that we've been speaking about in the province is the budgeting model from a national has to be relooked and rather approach a priority-based modeling or a project-based modeling. And in that way, we would reduce the silos because it's still turf and territory, it's still in terrain. I think that is very critical, a learning lesson that's come out of this process. Thank you.
Great. Thank you very much for that. The last question is that SMMEs have been mentioned and they are the ones who got hit hard throughout this process. However, this could also be an opportunity for SMMEs given the transformation targets that we also want to reach. What are the plans when it comes to that, to make sure that the SMMEs become the integral part of this process and the opportunities that exist, they also accrue to such SMMEs?
No, thanks, Chair, for that one. The Executive Council of the Northern Cape Province have already now instructed the Department of Economic Development to take stock of all the SMEs in the province and also on a continuous basis provide training to the SMEs. But also what they have said that most of the aspects and complaints that have been coming from the SMMEs, that's why the hardship is that most of the service providers have been coming from provinces outside the Northern Cape. So also there they have said that there must be a split. We cannot keep out all the people, but the Executive Council have given a ratio to say that so many people in the Northern Cape, from the SMEs, people with disabilities, women and so forth, must be empowered in this process, but still within the framework of the PFMA and so forth. So those are the kind of the initiatives that is happening. They are training, they are already busy training the SMMEs, but also we are creating and we are communicating actually also now at this point in time to SMMEs of the opportunities that are out there.
Great. Thank you very much for that feedback. For our colleagues who are participating online, please comment and post those questions for the presenters to address. Thank you very much. We'll move to the next presentation from Mpumalanga province. So, like I say, Mpumalanga and the presenter there, Nomusa Mlondo, who is going to take us through the presentation. All right. We getting the presentation ready. Mr. Godfrey, are there some key themes you're already picking up from the previous presentations?
Yes, of course. Thanks, Chair. I think what the case of Northern Cape case study has actually brought about is that the differences that we spoke about in the beginning, that whereas there is a national disaster that we are facing of COVID, it manifests itself in different ways in different localities. So the way Northern Cape has dealt with it is that they've been more on the ground implementing adaptive strategies. I've picked up about 7 of those adaptive strategies, which I think are important to profile in this instance. I think the should I continue?
Yeah, please continue with your yes.
I think the central coordination that is driven by the Prov joints and the work that's done on the district development model to reduce duplications, having realized the squeeze on the resources that the province is dealing with, the issue around a resource mobilization that's connected to that particular approach that's driven centrally from the Premier's office, the issue of academic support to help catch up, especially the initiative of Maths and Science. Very interesting, a case that I think other provinces can actually learn from. The participatory government approach, where the state-society interactions have been activated to even deal with the issue of coordinating social relief measures that are deployed in the province, including also the provision of water tanks and the food supply. So those are some of the things that I think are very important that have come out of this case, the adaptive strategies. Some of them which the presenters even said that they are looking at ways to embed them in the way that the province operates. Thank you.
Great. I believe the presentation from Mpumalanga may be ready now. All right. While they are still getting the presentation ready, those are the interesting insight, Mr. Godfrey, the adaptive strategies and the pillars that you have highlighted. Any comments that you would like to make regarding the new cases, the emerging cases, and managing them going forward?
I think it was important to note also the way the Northern Cape has activated these reporting mechanisms that are required nationally. On the, they made mention there of the reporting that's required in terms of the disaster management, the coordination of data, key data. That's important to build up to the national picture and also disaggregate at the district level. The continuation on the monitoring of the quarterly EQPRS, which is the quarterly performance measures of the province, to where they indicated in the beginning of the discussion to say the performance of the province from their analysis of the EQPRS information. The performance of the province has actually slowed down in certain areas. They can actually be able to articulate very clearly what those things are. Sure. But then again, the need for capacity support for monitoring and bidding data support that will help to profile what's actually happening in the province. So we may need to have a further discussion with the office from the DPME point of view to understand what else need to be mobilized going forward in terms of the capacity to support the province in completing the case study.
Okay.
Thank you.
So given that the data seems to play a very significant role in managing this COVID, are there plans to build a central repository of data so that you have a national view of what is happening?
There is already capacities in place that can be tapped onto. The National Policy Data Observatory, which was built on top of the data center at the CSIR, which I mentioned earlier. It has profiles of information from across the provinces, broken down into districts and localities on various aspects. So it will be interesting to see if colleagues are not yet aware of what exists there, to have a demonstration of what actually is in place, because so much can be tapped on without necessarily duplicating development of existing capacity. Because what is good about that process, I am involved in that process, is that it's able to listen to the data requirements of various sectors, including also provinces, I guess, that it's able to listen to those and see how those needs can actually be incorporated into the design of the system. So it's the capacity is there. It's one of the things that when I said I invited Northern Cape for a discussion, I was actually thinking about it to say there is existing resources, data resources capacity that provinces and districts can actually tap onto to support them with their data.